And I think this is what makes EMDR quite different from talk therapy, maybe some of the cognitive therapies where you're not doing this free associative processing. So let me go back to explaining what standard EMDR looks like. And with it, with how we do it from the Parnell Institute, is we set up all the safety, history taking, context. And then when you're ready to do the trauma processing work, you light up the memory network. And this is key to this. You know, what picture represents the worst part of that incident? Let's say it's a car accident. What picture represents it? What are you feeling emotionally? What's happening in the body? And what is the negative belief or negative cognition? So that can be, I'm going to die. I'm not safe. I'm powerless. So we light that up.
How do you light that up? Do you get them to process it? What is the process?
You've just had a car accident. And you're coming in for EMDR, it's lit up pretty well. So I might just say, close your eyes, go inside, bring up the worst part of that incident for you, the part that you keep seeing. Oh, it's the moment right before the truck hits me. I can see it coming towards me. Okay, in that moment, what are you feeling? And I'll say, just go inside yourself. Oh, I'm feeling terrified. My body's shaking. I feel sick to my stomach. What belief goes with it? I'm going to die. And then we start the bilateral stimulation. So we light it up and then we put our foot on the accelerator and we begin this accelerated information processing. So the bilateral stimulation, be it eye movements, auditory right, left, tapping, drumming, it sets off this rapid processing effect that is like mind-body free association. Thoughts and feelings and body sensations, cognitions, memories, links just start very rapidly moving through. It's if you imagine neural circuitry, the electrical currents going very rapidly to these different areas. And so we do a set and we check in, what's happening, they tell us, we go with that, and we keep checking back with the incident until the distress is gone. It's gone from the body, it no longer has emotional charge, and there's a new view of it. I call it objective memory. It goes from being psychologically, emotionally connected to it happened in the past, as I'm reading about it in the newspaper. I'm okay, I survived, I'm okay as I am. There's a positive belief that naturally arises, and we link that up with how they now view the scene. That's in a nutshell what a session looks like. But it can go, oh, that accident reminds me of how my father used to beat me as a child. I'm innocent, I'm not doing anything wrong, and somebody comes at me, and then boom, they're no longer at the car accident, they're now in an abuse memory. So the therapist has to be skilled enough to know how to manage that in a way that feels safe for the client, to not just go, okay, now let's just do that, and then open all of that up. And then the person is flooding because they've opened up a childhood trauma memory and they still have this car accident opened up.
Oh gosh, and you could even pair them, couldn't you?
It amplifies it. So the therapist needs to know, let's leave that, we'll put that in a container and we'll just stay on this accident and complete that. So that's a little bit about EMDR. And what we say with EMDR is that in order to do EMDR, the client has to have enough ego strength to handle it. They have to have the capacity to feel strong emotions and to go to these places that feel really uncomfortable. So they have to be able to ride these waves of strong affect to move through. And if they don't have that, we're going to do something different with them. We're going to strengthen them. We're going to prepare them. And we can do more of this imagination and bilateral stimulation to even work on strengthening them that can often reduce the level of distress in the trauma memories.
That makes a lot of sense. Could you talk a little bit more about bilateral stimulation for those of us out there, the idea of tapping back and forth, but what is actually happening inside one's brain during bilateral stimulation?
I don't really know what it is. And there's a lot of different theories about what's going on. And what we can see is it sets off this very rapid processing effect. There's research being done, especially on eye movements and the effects of eye movements. But I don't use eye movements in my practice anymore. I haven't for maybe 15 years because clients didn't want to do it. They much preferred holding these little pulsars that buzz right and left, or having headphones that make tones go right and left, to making them move their eyes through their tears. People didn't like doing that.
Oh, that's so interesting. So you have, some of the different methods, and we're talking lateral in some ways that we're having stimulation go back and forth and back and forth and back and forth to the different hemispheres. So instead of it being focused on one, you were mentioning that trauma gets stuck in the right side. And so you're revisiting the trauma in such a way, but going back and forth where we're stimulating the other side of our hemisphere that is going to maybe integrate the language. And is that a little bit of the, I understand it's a little bit of a black box in there, but that the bilateral is that we're activating both sides of the hemisphere at the same time while processing this information.
I think that it's profoundly integrative. So it integrates information that's located in different parts of the brain. For sure, it's doing that. It also desensitizes. So what's been highly charged loses its charge. It just goes down from being the accident's happening again to it's in the past. It doesn't feel like it's now anymore. That may be the integration of the left and right. And Daniel Siegel, you probably know Daniel Siegel's work. He said he believed EMDR does horizontal and vertical integration. It's integrating both hemispheres of the brain and also base brain, midbrain, frontal lobes. So you're getting both ways. By the end of an EMDR session, so the language centers are on the left side. Side is where the trauma is stored. People don't have the language. Often they don't have the language, and language isn't helping them. By the end, they can give you a narrative explanation of what happened. They can provide that at the end. You really see this shift. So I think it processes, it's integrative, and in some cases, it creates altered states of consciousness where there's a whole spiritual dimension that opens up for some people, for many people, that is amazing. And I think we're connecting to ancient practices. I think what Francine Shapiro stumbled into, and we've taught this all over the world, and we hear people from other countries going, oh, my Russian grandmother was a healer and she did this thing with eye movements. Or in the shamanic practices of the Amazon, we do rattling or drumming. Or you hear it all over the world. People have been using drumming and bilateral stimulation in healing practices. So I think we've just modernized it in a way. And I think one of my passions is working cross-culturally, working in different countries with different peoples and finding out what they've done and helping them rediscover the practices they have had and seeing how we can bring these things together.
Yeah, I love that because it was so funny. I just had a little light bulb moment as you were speaking, thinking about the drumming practices.
Right.
It's never crossed my mind, like sometimes the tapping, et cetera, until we just had this conversation. It never crossed my mind that drumming is bilateral. You're drumming with both hands. It's just like our tapping process. And so it's just at this moment, I'm like, wait, that's a bilateral stimulation. So I love the integration of the culture. This isn't something that we just discovered. This is something that has been around. And we're now, like you said, modernizing it and then bringing it into understanding on some level what's going on neurologically and why that can be.
Exactly. Yeah. And what's interesting, as I said, I haven't been using directed eye movements for many years. I had what we call the light bar where people were able to do that. And when I had this other device where they could hold these little pulsars and have headphones that were making sounds with the little buzzy things, nobody wanted eye movements anymore. They preferred to keep their eyes closed and to maintain more of an inner experience. They felt less self-conscious. They didn't get strain in their eyes. But what's interesting to see is some people, their eyes are twitching rapidly under their eyelids as we're doing these other forms of bilateral stimulation. So they're really not distinct eye movements versus drumming or tapping because eye movements are involved with both. I don't know what that means. The eye movements are involved. It looks like REM sleep. And that's one of the theories is that what we're doing with the EMDR, with the eye movements, is like what happens with dreaming sleep. Their eyes are moving very rapidly back and forth and we're processing information as we're dreaming.